Welcome to COVID Talks. Today I have the pleasure to have with me Dr. Tomas Cobo. Dr. Cobo is an anesthesiologist from Santander in Spain, and he is the first vice president of the General Council of the Medical Colleges in Spain. Good evening, Dr. Cobo.
Good evening.
Dr. Cobo, today the figures for Spain are really stunning. You have 150,000 confirmed cases of COVID-19 in your country, and unfortunately also more than 15,000 people who died from the disease.
That's right.
That is a situation that must put the Spanish healthcare system under enormous stress and all the doctors and nurses working in it. So how do you see the situation right now in Spain, in your country?
Well, we have to be a bit optimistic in this tragedy. We are better than we were the last week. It seems that it is slowly stabilizing, but still today we have nearly 700 deaths. As you said, we have already, altogether, we have 152,000 patients with positive COVID. As I said, today we have 700 patients died, which is very similar than we had yesterday and the day before, but a bit far away than the 1,000 deaths we had the last week. So we are very bad, but nowadays we are not collapsing.
So your healthcare system and also the ICU situation is still coping with the demand you have?
Yeah, that's right. Last week, all things seem to be a real collapse. As I said, these days, thanks to the big military hospitals we had be able to build, we are better than we were. But still we are in crisis. Still, we are very expecting what could happen.
In nearly all of the European countries, we see a shortage of supplies, especially of personal protective equipment. Is that the same in France? In Spain?
Now we are starting to have the right equipment, but that's been the big problem. I'm sure you know that we had nearly 14% of professionals working in hospitals and in GP centers have the COVID. Of all of them, of the 100%, 14% are sanitaries. So we had this problem last week and the week before, but nowadays we are starting to have the right equipment. But no doubt that the big problem at the beginning of this crisis was the protective equipment. We didn't have any, or very few, not even the surgical masks.
What is the age distribution of the patients you see in Spain? Is it also a very high degree of cases in the older population, or do you see also a spread into younger population?
No, the contagion spreads in all population, not the people less than 25 years old, but from 25 till 80 plus, the contagion is the same. The difference is, tragically, the deaths. And most of people dying is above 80s, about 75, 80s. But the contagion is for everybody from 25 years old.
And in the severity of the cases you see in the ICU, do you see also a number of cases with multi-organ failure, or is it only the lungs?
Yeah. No. They go through all the process. It's very quick, because initially when they go to ICU, the patient is shortness of breath, but very quickly, very rapid, develop ARDS, and they go into the cascade of sepsis. So the main problem is initially the lungs, with lung fail, and then it goes very quickly to the sepsis cascade with multi-organ failure. Yeah. In our ITU, I tell you very real things from this morning. In our ITU, we have now 22 patients. Of those, we have 17 patients with mechanical ventilation, and the rest are breathing through the high oxygen masks. Of those 17 patients, we have 9 with a hemofilter. So as I said, the initially is the respiratory failure, and then progress rapidly. And when I say rapidly, when I say quick, I say in something like 40 minutes, 45 minutes, they go drastically down with a very quick desaturation and very, very low PO2, and need a quick intubation. Yeah. And then the problem is that they stay with the mechanical ventilation for so many days, so that ITU bed is blocked. And that was the problem we affronted last week, because we didn't have enough beds. In our hospital, we have to organize. Our ITU is 9 ITU beds, so we have to organize the recovery room, and then we have to organize the operating theaters to ventilate patients. Luckily, we didn't use as yet the operating theaters, and we very slowly are liberating beds from the recovery room. Last week we had one day we had 7 ITU beds the same day, and now we are having 1, 2 every day. So far we are coping. But in Cantabria, in Santander, we have a very big teaching hospital, and then we have the hospital in which I work, it's a district general hospital. And altogether we have 150 beds, ITU beds. But that's because we, in the teaching hospital, we organize big units for ITU. And now they have 42 patients in there. So, but we are able to cope with up to 150. So we are ready now. We had enough time. But that's in Santander. That's in the north of Spain. Very unfortunately, in Madrid and in Catalonia, they were not prepared for all of this. That's the reason why they, at some stage, the last few weeks, the last 2 weeks, they didn't have enough ITU beds. And that was when they organized this big military hospital with 5,000 beds in the IFEMA. Thanks to that, they are coping now better. But they really had lived a very, very dramatic situation with huge ethical problems at the time of decide who is a candidate for mechanical ventilation and who is not.
Spain has seen a very difficult time after the last financial crisis in 2008. There have been a lot of austerity measures. Have those austerity measures decreased the capacity to deal with such a pandemic?
Yeah, I think so. I think the public health system has not been really helped by the politicians, by the governments of one side and the other. We have 7% of the PIB invested in the NHS, and we really think we need more. Yes, I think that's part of the reason. But the other reason is the lack of strategy. We knew that happened in China, and we didn't take the measures. That's for sure. We didn't have enough equipment for protection. We didn't prepare at all the ITU beds. That could be done before. We could be ready, and we had to do that very quickly, very rapidly, without plan. I think things could be done better. Anticipation failed, definitely. The risk was trivialized. And the threat was underestimated, no doubt about that. The virus was considered to be similar to the influenza, both due to the type of the disease and the lethality, as well as the protection measures were really deficient. We lost 2 precious months to be prepared for this, and we didn't do it. So we are trying now. I have a meeting tonight with Nicaragua and with Bolivia, to let them know in which things we had failed, for them to be prepared. And that's what we did not with Chinese and with the Italy problem. I personally think we had a very, very poor strategy for coping with this problem. Yeah.
Now, as anesthesiologist, you are very much engaged in the COVID treatment directly. As the first vice president of the General Council, you must be also looking into the question of the healthcare as a whole. So, do you see that there is now a problem with a lot of healthcare capacity missing for other cases which also would need treatment in hospitals, in ICUs, or in general practice in general? Is there a deficit?
Well, nowadays, you mean during the crisis
Yes.
or in general?
No,
Yeah,
during
during
the
the crisis, the
crisis.
problem we have is, as far as we prepare theaters, operating theaters, to cope with these patients, with COVID positive patients, we have to stop the surgery. The surgery of the oncological surgery of all the specialties of gynecology, urology, all the oncology surgical problems are stopped. So this is nowadays a lack of treatment of these oncological patients. We'll see what are the consequences of all of that. But nowadays in my hospital, all the oncological activity, surgical, is nearly stopped. So that's always is going to be a problem. Yes, no doubt about it. And the thing we have with the NHS, you were asking me, the thing we have with the NHS for the last few years, meaning few years, the last 10 years, is being used as a political weapon with politicians of one side as other. And they've been very worried about the waiting lists. And they really not understood what is the main NHS system and what sort of expectatives they have created in the society. And people expecting to be operated of his hip or their hip in 2 weeks, 3 weeks, or 6 months. They didn't realize that sometimes that's not possible. Then when this crisis has come, this problem is going to be huge. NHS, as we understood NHS, probably is not going to be the same in the near future, because we are not going to have money, we are not going to have even time. Let's see if we keep our vocation. We have a lot of colleagues dying. I think we already have 17 doctors died directly because of the COVID virus. And in some cases, very, very directed to because of the lack of protective equipment.
That's certainly a very tragic, and especially
very tragic, very tragic, very tragic. And we have doctors that don't want to go to work because of the risk, not only for them but for their families, because you have to go to hospital and back to your family with kids or with all people living with you. So this is going to be a big problem in the next future. Let's see.
Dr. Cobo, thank you very much for this talk. I hope that you have seen already the peak of the wave and that it is now going slowly down, and hope that the number of deaths will come down rapidly. Thank you very much for this talk.
Thank you very much to you. Thank you very much.